Welcome to Medical Montana. We're here at Helena ENT visiting with Dr. Pargett, and we're talking about chronic sinusitis. In the past, we've talked about CAT scans. We've seen normal CAT scans, deviated septum CAT scans. Let's talk a little bit about abnormal CAT scans.
Well, an abnormal CAT scan will be one where people will have sinus infection and sinus disease. And an abnormal CAT scan may also be where the anatomy or the structure of the nose is abnormal, causing them to have sinus problems. I have an example of an abnormal CAT scan here. And if you remember before, we talked about the eye sockets being here, the wall or the septum being there, and the sinuses on a CAT scan should be black, which means they're filled with air. Well, if you look at this CAT scan, you can see all of this stuff here, and this is actually fluid. It almost looks like milk in a glass. You can see that there's all this trapped mucus and even bubbles in the sinuses, and the sinus drainage areas, which are right here, that should be normal, they're completely blocked. So this person's going to have a stuffy nose, they're going to have thick drainage, they're just going to feel awful. And this is someone who will be sometimes seen in my office, or even if they're seen by their family doctor, will get on antibiotics. Sometimes an x-ray like this, unfortunately, will be seen when someone's already been on all the medicine they can be on and they feel no better at all. I'd also like to mention that CAT scans really should be evaluated by a specialist, and that's one of the things that I like to do in the office. I always go over all the CAT scans with my patients because sometimes someone may have heard that they have a normal CAT scan, yet they continue to have problems of headache and pressure and congestion. And what that means is chronic sinusitis is something that we diagnose by an exam, by an evaluation in the office. It's how they've been feeling. A CAT scan helps us to decide where the infection is and why the infection is occurring. So I always look at all of my CAT scans with my patients, and we will look at the structure and the anatomy of the nose and can help them to see where their sinuses may be having trouble and then how I might be able to help them. And if they have symptoms like we've talked about, congestion and headache and feeling tired and just not feeling very good overall, they can do a sinus assessment survey at helenaent.com, and then it's really important that they come in, get evaluated, let me listen to their story, look in their nose, and then if we have CAT scans to review, we can talk about why their sinuses have been giving them so much trouble.
Well, and it's obvious looking at this photo why they would be having trouble when it's so much blockage.
Oh, this person is miserable, I'm sure.
Absolutely. Thank you, Dr. Pargett.